Endoscopic retrograde cholangiopancreatography, ERCP, has been widely performed around the world for patients with biliary and pancreatic disorders. Despite being an important diagnostic and therapeutic procedure, ERCP is always invasive and procedure-related complications occur with ranges from 5 to 10%, with an overall mortality of 0.1 to 1%. Furthermore, despite its low incidence, duodenal perforation occurring during ERCP has been shown to cause high mortality of between 16 and 18%. Patients with duodenal perforation have traditionally received surgical treatment. However, in the past decade, operative management has been used for selected patients only, such as those with open or large perforations. Duodenal perforations that are related mostly to manipulations of the papilla, such as sphincterotomy, or guide wire usage during ERCP, may develop in the retroperitoneal area with few signs of peritoneal irritation. Medical management may often be sufficient for these patients. Nonetheless, there has been no consensus regarding treatment strategy for such patients. Because of the rarity of ERCP-related duodenal perforation, there have been only a few case reports or case series on the clinical outcomes of affected patients. Furthermore, most previous case series regarding the clinical course and management of ERCP-related duodenal perforation have been single-center and small-scale analyses. Their outcomes have depended on an author's sole personal experience, and no large-scale multicenter study has been so far reported. Therefore, Young-Joo Jin et al. Performed a multicenter study for assessing the clinical outcomes of ERCP-related duodenal perforations according to the observed clinical parameters and treatment options. In addition, they proposed a strategy on the basis of the data analysis for the treatment of ERCP-related duodenal perforation. Their findings are reported in their paper entitled Clinical Course and Proposed Treatment Strategy for ERCP-related duodenal perforation, a multicenter analysis. Here is a summary of the paper. Background and study aims. ERCP-related duodenal perforation is rare but can cause high mortality. The aim of the paper was to assess the clinical outcomes of these events. Method. A total of 59 patients who were diagnosed as having ERCP-related duodenal perforation at 6 institutions between 2000 and 2007 were enrolled in this multicenter retrospective study. The authors evaluated complications and mortality associated with ERCP-related duodenal perforation according to injury detection time, IDT, peritoneal irritation signs, PIS, systemic inflammation signs, SIS, and treatment modality in these patients. Results. Of the 59 patients, 41 and 18 underwent medical and surgical treatment respectively. Duodenal perforation-related death was observed in 5 patients. 2 of them had received medical therapy and 3 had received surgical therapy. Among medically treated patients, 7 patients underwent endoscopic clipping immediately after the injury. Surgery was not required as a salvage therapy, and there were no complications or deaths among these patients. The remaining 34 patients received antibiotics combined with therapeutic fasting and intravenous hydration. Duodenal perforation-related complications depended significantly on injury detection time, treatment modality, peritoneal irritation signs, and systemic inflammation signs. The duodenal perforation-related mortality was significantly related to injury detection time and peritoneal irritation signs. IDT, PIS, and SIS appear to be important prognostic factors following ERCP-related duodenal perforation. Medical therapy can be suggested as an initial treatment strategy for ERCP-related duodenal perforation, and, if possible, endoscopic clipping is strongly recommended. However, surgical treatment should be considered if the perforation is not expected to seal spontaneously, or if the continuing leakage causes peritoneal irritation signs or systemic inflammation signs.